Yep, and it looks like we are now officially live, and love to welcome everybody who's here. Dr. Jess Montalvo and I are here a little bit early to get things rolling, so that's really kind of cool. And we're just going to kind of hang out for a few minutes and let everybody get going. But pretty excited that we can start to have Empowered by Lyme reactivated now, Jess, after a long hiatus, and it's super exciting to be able to welcome everyone. And I saw that we were live on something a second ago here. Let's see, where is our recording going? Here we go. All right. So super cool. We are still a little bit early, but love to welcome everybody here who is coming in. We are, let's see, Empowered by Lyme is started a long time ago and is one of these things that was really a way to serve and give back and to support everyone who's going through this journey, a place where we can have a positive support group to really help and really be leaders in healing, both in chronic Lyme and other tick-borne environmental illnesses, but also in chronic conditions in general. Like whatever your chronic illness is, like we all know we need to focus and look on what the challenges are. But the next part is we also want to be sure that we are keeping a positive mindset and supporting each other in our healing, acknowledging when things aren't going the way we want, but also really getting serious about not going down the rabbit hole, of hey, this stinks and everything sucks and I'm never going to get better, because we know that that's a self-fulfilling prophecy. So it looks like we are now at 6:00 on Mountain Time, which is then 8 p.m. Eastern and 7 p.m. Central, I think, and who knows what time, probably 5 o'clock Pacific. Really cool to see everybody. I'm Dr. Tom Moorcroft, and I've been gabbing a little bit because we went live a few minutes early just to make sure we had everything working. So welcome to our event this evening. Really excited to welcome my good friend and now partner in crime, Dr. Jess Montalvo, who is joining us. And, tonight we really wanted to kind of talk a little bit about Lyme disease basics, some of the things that our practice and myself have been doing to help people move forward, both clinicians and practitioners and patients in healing, and then really spend a little bit of time on some of the things that Dr. Jess is an expert in that I know about, but I'm not the expert in. And some of those things include the appropriate use of different psychedelics and even cannabis in healing. And both of us have this functional medicine background and this functional medicine lifestyle that we follow. But this is really one of those things where I think it's so important to frame the conversation about Lyme disease and all these other tick-borne illnesses in a place where we actually have hope for healing, where we're not just surviving, but we're actually thriving. And we're going to be doing a whole bunch of different, events over the next several months. And we're going to be in here a lot more. And we really want to start to share these bits and pieces with you. So we're not going to cover everything tonight. What we're going to do is give you kind of a great background on some of the things that we're interested in, places that we're going, and we're going to jumpstart. And one other thing I wanted to say too is welcome back to Empowered by Lyme if you've been a member for a while. And we've kind of been on a bit of a hiatus. And if you're a new member, welcome. And the goal here really is to create that community, a place where you can come and ask some of your questions and kind of get a no-holds-barred answer to some of the tough questions. There's so many options out there for you. So the most important thing to remind you about is that we really do want you to be working with the practitioner if you do have health concerns, that they can help guide you individually. But in the group, there's a lot of things that we can discuss, a lot of the emerging research, a lot of the conversations that are going on out there. As an example, Dr. Jess, one of the things that I know that comes up and we talk about in our Lyme disease practice mentorship program is that, babesiosis, there's some of these babesias that are emerging, like Babesia otocoilii. And it's one of these things where we're finding that we don't need, some researchers say it causes human infection. Other people say it doesn't cause human infection because, or I shouldn't say that, they haven't seen it yet. And so the question is like, well, why are some people treating it if we don't even know if it's a thing, and what do we do with that, right? And so this is a great conversation for both practitioners and patients to be a part of. And that's one of the examples of things that we can talk in general concepts with and provide a lot of support. So anyway, before we dive into all of that stuff, since I've been babbling and a lot of people may or may not know who I am, but they'll get to know me over time, I would love to take this moment to, introduce you and maybe let you tell everybody a little bit about yourself, where you're coming from, what your interests are. And also, for anyone who doesn't know, we're welcoming Dr. Jess to our practice, which is really a great thing because there's so many people suffering. And now, Jess, together we can help even more people. So welcome.
Thank you so much, and I will apologize in advance, everybody, if you hear me feeling a little bit hoarse. It's just some of the seasonal crud going around, but I assure you I'm well, and I have enough water, so we should be good to go. And I really got into this whole Lyme situation because I started down this road into functional and integrative medicine. I had a very traditional medical career before this. I was a hospital-based physician for over 10 years. I did a lot of work with oncology, palliative care patients, very seriously ill people, often who were close to end of life. And while that work was very meaningful, I really found myself wondering, what could I do to actually meet people sooner? Much sooner in their journey and impact their healing in such a way that they might get back time, quality, that I just didn't feel like I was able to provide that whole situation for them in that previous practice paradigm. And so I discovered functional medicine with sort of all the usual suspects, podcasts, books, and found my way into various training programs. And in one of my first jobs as a contract physician, I just saw how much Lyme I was seeing. And I realized that Lyme is so fascinating. It's also super complicated. And I decided I needed some specialty training. If I wanted to take care of these people, I was going to have to learn from someone who had been doing this a while, who had a lot of experience, but also a good handle on evidence. And this is how I found Tom. I happen to be, I think on an email list for the Lyme Disease Practitioner Certification, and now here we are, more than a year and a half later. I've been, in that training group. It's been such a changing experience for me because it made this very complicated entity of Lyme and co-infections and all of these associated conditions, mold, MCAS, started to really build a strong foundation. And that, is really what I look for, because I think that if you're attracted to working with more complex patients, which I am, you can't expect to just do that without a roadmap. And that roadmap comes together with a lot of different training, and you spend a lot of time learning with other people. So that's really how I come to be here, and now also part of Origins of Health.
Well, Jess, we're so happy to have you here with us, and it's one of those things where, like, I feel like the same thing. I kind of got drawn down this path because we saw people who were suffering that we could really help with. And one of the things that I think I'm curious what your experience is in terms of, like, when you see tick-borne illness, Lyme, Babesia, or whatever. I mean, there's a lot of questions and background and everything, but what are some of the what are the key concepts that you're seeing where we need to make sure that we're hitting the nail on the head? You know what I mean? Like, what are the important pieces that people should be looking for, maybe when they have a concern they might have Lyme, or they have, they're looking to see if they have that diagnosis or whatever? Are there things that pop out for you?
Yeah, I think for me, if I had to choose maybe the three biggest symptoms, let's say, that would make me think about an undiagnosed tick-borne infection, I would say just unrelenting fatigue, where they have had blood work, and everybody tells them everything looks fine. Just unrelenting fatigue, and especially fatigue that has maybe gotten not just worse over time, but kind of like sort of comes and goes. Like you can have some days that are sort of okay, and then other days are just really not. They can sometimes do like a good workout, and then other times they do a workout, and now for 3 days they're in recovery. So just these kind of unrelenting fatigue stories always get me thinking about the possibility of a tick-borne infection or multiple infections that have been diagnosed. I also think that unexplained or odd patterns of joint pain, which obviously we talked about, and you did a really good job of drilling that into us, that migratory joint pain in many ways is really one of 3 entities until proven otherwise, and Lyme and I think Bartonella are on that very short list, that you really have to be thinking about that if this joint pain seems to jump around, and there's been no obvious issue you were playing tennis and now your elbow's inflamed because you have a tendon that was inflamed during the workout. I mean, that's a precipitated joint pain. But with the stories I tend to hear, with these infections, are that, this one joint will bother me, and then it feels like it just goes away. And then another joint just kind of pops up, and now that one's bothering me. And then at some point, maybe that first joint will start bothering me again, but it's completely variable. There seems to be no relationship to activity, or any particular injuries, things like that. So I think that's that's a big one. And the third one for me are just what I call the weird nerve pains. Anything where there's kind of a numbness, tingling, even burning sensation, a shooting sensation. There's many words that we use to describe nerve discomfort, and we can see those symptoms, of course, in people who say have poorly controlled diabetes. That would be a reason to have certain kinds of nerve pain. We might see this in somebody who has some kind of structural issue. Perhaps they have an impinged nerve due to a disc or something going on in a wrist or an ankle. And so those are structural issues, and generally tend to present with a particular pattern of pain. But these types of pains that come along with the Lyme and the Bartonella and the Babesia, they're kind of all over the map. And again, they kind of come and change without warning. It can be like I'm numb in this little part of my arm, and also on my upper left leg, it's patchy. That anatomically, doesn't really fit, with oh, this is a nerve root problem, or this is a some kind of structural issue. So those are really kind of the 3 biggest things that I think about now.
Nice. Yeah. And I mean, I think it's interesting. It's those oddities, right? Migratory pain is gonococcal arthritis, certain hepatitises, inflammatory bowel disease maybe, or Lyme. And that's it, like you said, and I always say Lyme or friends, so I think it's a really good highlight, and a big shout out to Dr. Richard Horowitz, a great friend of all of ours, a mentor and a guru, sort of pushing forward, doing all this work, to help alleviate the suffering of patients, by doing the work that validates migratory joint pain and migratory neuropathy, or numbness and tingling, as one of these really sort of key pieces that focus you in on Lyme disease. Because there are so few things that lead to this migratory joint pain, we know that we're not really, that if that's present, the differential that we call in medicine, which the differential diagnosis is kind of the list of all the reasonable possibilities, and the most serious possibilities are, that we're checking off in our head or even on a piece of paper. We know that list gets really narrow when you start to have that migratory joint pain. So, and I would say too, Jess, from my experience, the migratory numbness and tingling, I don't know how much of it's Lyme. It's hard to pull apart from Lyme and Bartonella, but I find that there's a lot of Bartonella that I think is responsible for that. So, as you highlighted, we've got both of those things playing a role. And sometimes we don't even need to know if we need to know if one or both are present, but whether or not which one is causing that particular symptom. I remember we talk a lot about, heel pain or sole pain, and one's Lyme and one's Bartonella. I looked at all the research. I ain't seen anybody been able to figure that one out. But what people have been able to figure out for us is that one or the other, Lyme or Bartonella, are present, right, when you have this stuff. And I remember back in my history, when I had Lyme disease and babesiosis, one of the things I remember is like resident medical school surgery rotations. Wow. The foot pain of standing on your feet for like 14 hours a day was horrific.
That's
right. But then I got treatment. And all of a sudden my feet were sore because I was on my feet for 14 hours, but I wasn't feeling like somebody was stabbing me with a lightsaber in the foot or the arm, So I think that that's a really important piece of healing there. So, and that's like, as you were saying earlier, one of the things that we do in our Lyme disease practitioner training program, and it's a mentorship and certification program that we go through, a really intensive 6-month curriculum and, at least a year, if not more, of mentorship of these real cases, because everybody kind of presents a bit differently. So you highlighted really well, and the goal really is to have our community, just like this community of support for people, to have a place to go to really talk about and ask about the burning questions, and kind of get the anybody who knows me the filter doesn't exist much, so you're going to get the unadulterated Tom answer all the time. So, but and that's really what we do it for, so we can have these conversations where you can get the answer that you can't always say in public, right? Or it's we need to talk to truth. And even like we have a Healing from Lyme Disease Summit that Dr. Jess is on, and myself and Dr. Engels are putting on. So look out for that to come out. I think it starts May 9th. But a lot of what we're doing is try to dispel myths and give you guys the core understanding of the science as we know it, discuss where the science isn't keeping up with helping you get better yet. It will eventually, but where the gaps are. And then what do we do in that art of medicine to help you get better? So Jess, I think one of the things that I always find really interesting is that so many of the people that I've interviewed for this summit that's coming up and worked with, including you, is like, we all understand that if you have an acute exposure to Lyme, you should probably beat the crap out of it. But then we go into this chronic Lyme thing, and everybody's got a different story. When you're looking at a person and you're trying to start somewhere, so aside from the diagnostic workup, which is probably a week-long conversation anyway, at least a couple hours. So we don't need to dive into diagnostics, but outside of just looking at tick-borne illness, what are the things that you're looking for a strong foundation for a particular person? Maybe they've been struggling with these symptoms for 6 or 8 months, or a lot of our people even several years.
Years.
Yeah. Where do we start? Or what are some of the possible starting points? Because obviously it's all unique to the individual, but...
Right. Well, I mean, certainly, as you said, we want to confirm our suspicions. You've always done a lot of good discussion, for us in the certification about how, at the end of the day, many tick-borne infections, like these 3 big ones we talk about, Lyme, Babesia, Bartonella, you should have clinical suspicion for these infections before you go testing for them. And I think that is important. So we do need to document that the infections are present, or that the pathogens have been in play for that person. They've been exposed at some point. So we need to, I think, have that clinical impression, put it together, with the fact that, yes, indeed, they have been exposed. The signal, so to speak, is quite strong, with their testing. And then when we're trying to think about where to start, once we've kind of got, a sense of maybe that piece, well, I think that, really where you need to almost kind of be thinking on 2 or 3 planes at the same time. First of all, they may not just have tick-borne infections. Part of the reason so many people, I think, suffer with these persistent tick-borne infection symptoms is that there's other things that are weighing the immune system down, and the immune system can't keep everything in the box, as I like to say. It's just the phrase I'm always using, with people. when I see them, is that the immune system is supposed to just kind of keep things reasonably under wraps. It's supposed to kind of keep an eye on everything that you've got going on. There are plenty of people who I'm sure may have a positive test for Lyme and they feel fine. And they're walking around and there's really no issue that they don't even know. And that's because in that situation, the immune system is keeping that pathogen and its associations at bay well enough. But there can come a point where, for one reason or another, the immune system cannot keep it under wraps anymore. And sometimes that's just a question of too many burdens have hit. Maybe there's mold, maybe there's heavy metals, maybe there's some other entity that's dragging that person down. Maybe they've had a really difficult couple of years. I think it's a really common story, I'm sure for you as well as me, that sometimes these really unrelenting symptoms start at some stressful period of time in life. And it's not that the exposure to the Lyme or the other infections necessarily happened at exactly the same time. It probably came, long before that. But the immune system took its eye off the ball because there was too much going on. We know that chronic stress, whether it's kind of generated from here in the outside world or generated from within our body, makes the immune system act inefficiently. So it just can't do its job as well. So I think that, one big plane is you've got to be thinking about what other things are weighing this person down. What is preventing maybe their immune system from functioning as well as it can. And there are, of course, ways you can go about that. You can investigate those other entities. You can look at immune system markers. There's obviously a lot of different ways you could start there. And then in terms of the foundation, what is it that we need to see or want to see for somebody before we start thinking it's time to put together an infection-centered treatment plan? I feel like we need to make sure that some of the basics are in place. Are they eating? Are they having a reasonable amount of nutrient intake? If they have a lot of nutrient deficiencies, they're going to have trouble tolerating their treatments. Are they able to go to the bathroom every their ability to tolerate treatment? So I think sometimes, we get very excited about the herbs and we get very excited about the antibiotics, and those all have a place, and there's so many other options out there. But sometimes the basics need to be in place before we can really go down that road.
Yeah, I agree wholeheartedly. And I really think going back to those basics of sleep and eating and assimilating, and also we talk about detoxification, and as you know, Jess, a lot of the things I really like to talk about have to do with really going back to the things that you guys can all do at home to take care of what's happening to help you get a little bit better. And it looks like Jess kind of popped out for a second. Now she's back. Good. And so anyway, sleep is one of these things where it is so important because about 90%, some authors, maybe 80% of your brain detoxification happens when you're in sleeping. So especially deep sleep. So sleep needs to become a priority, and it's a foundational piece because I can give you all the supplements in the world and all the IVs to clean out your brain. But if the actual system that takes the fluids and move, because there's kind of like a wave of detoxification that goes through the brain. If I'm trying to drain out your brain and then use those supplements to optimize that and also to maybe grab hold of some of those toxins, like we might use a glutathione and arlipoic acid type of thing, and ultimately in our gut, some of our binders. If you're not sleeping and you're not, that glymphatic detoxification system of the brain is not given the time and the type of rest that it needs to function optimally, all your supplements aren't going to work, right? And if you're not eliminating, maybe you need some help with the sleep or the elimination, meaning the pooping. But yeah, these are basic things that have to happen, because the problem is, one of the things that we learn a lot from mycotoxin illness is that the toxins are getting released by your body, but some of them are getting recycled. And the problem when we get recycled is it starts to gum up the system. So if we just keep dumping toxins without helping them actually get through, without making sure the system is actually able to clear them out, it's not going to work. So your focus on the fundamentals of how the body works is so crucial. And I think that that's where we, like at Origins of Health, we make such a difference in people's lives, is because we're happy to look at the Lyme, we're happy to look at the Bartonella, we're happy to look at the mold, but we would prefer to look at you as a whole human being who has a personal life, a family life, goals and aspirations, and also happens to have these things occurring in your life. So we're not just going to be taking this approach where we're only treating Lyme with antibiotics, or we're only treating with herbs, or we only treat Lyme, but we don't treat mold, right? And it's not that we don't look at your cholesterol or your testosterone. We're looking at the whole thing, because I was just telling a story. One of our really amazing patients, lots of Lyme, Bartonella, mold on testing. We did a lot of treatment, didn't really work. Nothing was really moving the needle. And then I said, look, I know in the beginning your testosterone was kind of like this when I looked at it. Let's re-look. And I re-looked at it about a year later after kind of doing all these changes, and I brought it back down. We looked at the labs. The levels had gone down. So I said, why don't we start the treatment with the testosterone to optimize your hormones? All of a sudden, massive Herxheimer. So I was like, wait a second, what's going on? I call all my buddies who are like male hormone experts, because I do a lot of that, but I would not say that's my only gig, right? So I'm like, this is one of the things I think that I love about you, Jess, and I love about the way I practice is my ego has nothing to do with being a doctor, right? I mean, I'm sure a little bit, but my goal is really to get there, right? And to find out what the patient needs, and to help them get better, irregardless of what it is. So I'm like, hey, I think I know what's going on, but if I put my blinders on, I'm going to miss. So I just phoned a friend to make sure, and I talked to a couple people and bounced the idea off them to make sure I wasn't just doing the Lyme blinders. And they were like, everybody should feel better with that. We've never seen it. I'm like, good. I know that now I've given his body enough to be able to actually fight it. So we needed to optimize hormones in order for the immune system to even have a chance in this particular person. And so, but it's interesting because all of a sudden you're having a response that you would never expect. But then when you step back, you're like, oh yeah, wait, the body needs the right nourishment. And whether that nourishment is love, whether that's sleep or food or water, talking about the brain detoxification, the whole system's based on 99+% water. So water and hydration is good. So I think that's really important. One of the other, we had a couple questions. One was about, does migratory joint pain include migratory muscle pain? Technically, by the study, I would say no, but in clinical practice, yes, 100%. So, and I'm always trying to balance, and Jess probably is, you're probably sick of me saying this, but it's like, part of it is we have something in science that's been studied enough that we can make a reasonable conclusion for a larger group of people, and then we apply that information to an individual. But yeah, it didn't really come out as muscle pain. It's more like they have myalgias, which is our technical term for, our medical mumbo jumbo, so we can, feel good that we talk in not English anymore. But but definitely we see a lot of migratory muscle pain. And then the other part that I know that I've talked to you, Jess, about is I see a lot of migratory muscle fasciculation. So we're talking about migratory neuropathy, numbness and tingling. And there's a question about does tingling include odd skin sensations, kind of neuropathy and pain that can be anywhere? Kind of like the back, the back of your skull, maybe in your face or your extremities. Mm-hmm. Absolutely. This is just we call it paresthesias or dysesthesia. You can break it all down, but it's basically weird feelings, numbness, tingling, or just oddities. Yep. A lot of times people with Bartonella in particular, and also mold illness, will start to get the creepy crawlies under their skin, and it's migratory. So that's that migratory numbness or neuropathy type of thing. So all of these things can kind of be there.
I'm glad you brought up the muscle fasciculations, or somebody else did maybe. But because I think that can be a dead giveaway sometimes for Bartonella. I mean, I had a patient, one of my more interesting patients in the last year, who started to have weird muscle fasciculations and extremely intense anxiety after having a prostate surgery. Like out of nowhere. He was so anxious that he was worried he wasn't going to wake up the next morning. I mean, and there was no reason, sort of health-wise for him to feel that way. And he started having these jumping sensations like in his legs and the just visible fasciculations when he came to see me. They showed me videos on the phone of what had been happening. And I said, this really has to be Bartonella. And of course I test for it, and my test result was negative. And I said, no, I really think this is Bartonella. And we started, a treatment plan that included some things, for Bartonella. Of course, he herxed a ton. We got that under control with some changes. And then a few months into it, I retested, and did a different kind of test. And then those Bartonella antibodies were there. And so you just sometimes those clinical symptoms mean so much more than a test.
I think that that is one of the most critical things to think about is which I said, let's not talk about the diagnostics, but we kind of have to. But we don't have to get the nitty gritty of testing, and we can certainly do that at some point if folks in the group want to have a conversation about that. And it's a really important topic. But one of the things I would say is a lot of times, because people have been sick for a long time, these are commonly referred to as stealth intracellular pathogens. They like to hide inside of cells. They go to their Lyme and Bartonella in particular are known to be able to go into what's considered an antibiotic privileged state. Or site, or an even immune privileged site in the body, meaning they're able to get into places that your antibiotics and your immune system are unable to get to without some significant tissue damage. And so a lot of times these things are hiding. They've been around for a while. Lyme, one of the things, Jess, I think is so important, and I'm sure you've heard this from me a million times, but we talk about the conspiracy theory things that go on. And I'm like, what? We don't need to go there. That might be right. Investigate it and find out, get me some more science behind it. But Lyme has been found, the oldest known human infection that I'm aware of is over 5,300 years ago. But if you look at ticks that have been preserved in amber, we find that these ticks...
Millions of years.
Right? 13 million years for Borrelia. Things that are like Anaplasma and Rocky Mountain spotted fever, 100 million years. This way predates humans. Of course they know how to live in us for a long time. They just need a little... They're not like a parasite that technically a parasite is going to eat the host you're going to take the host nourishment from the host at the expense of the host, meaning ultimately you'll kill it. Lyme and Bartonella, while they can do things that could kill you, if you get an acute Bartonella endocarditis, or you get like a Lyme heart block, yes, acutely they can kill you. And are there stories of people who have had a really rough run with these infections and the total conglomeration of all the stuff that's going on in their lives, they end up dying, and there's a strong sense that Lyme and Bart could have played a big role? Sure. But typically what happens is they lead to chronic severe suffering, and these things basically just sit and live in you and reproduce a little bit, eat a little bit, long enough to just so they're living a long time. And one of the things, going back to your point, is really when you bring it back around, when you do the testing, in the beginning, it might not be it. You may need to treat it. You may need to support, because there's really two things going on. We need to bring down the load of toxin you have to deal with, and we have to improve your body's ability to deal with toxins. And so when we look at that, we really are saying, hey, the body may not be able to actually mount an immune reaction, because Lyme in particular is known to create immune suppression. In fact, the tick saliva has things that suppress a Th1 response, and then we also know that Lyme disease, the Borrelia burgdorferi spirochetes, that the causative agent of Lyme, actually go into the germinal centers in your lymph nodes and essentially prevent you from making antibodies to it. So the only way we can find the testing now doesn't work, and the immune system that's responsible for making the antibodies is now suppressed from multiple angles. So you sometimes need to do the foundational work plus the treatment, and then all of a sudden you're like, oh, it's positive because we helped the body recognize something was there. So I think a lot of what we're doing is that.
Yeah, I agree, and I think that that the whole point about you being able to suppress the immune system is huge, and this is like one reason why I think we have to be really open-minded about the different treatment possibilities with evidence, ideally, and practitioner experience, because I feel like a lot of what's happening with our treatments is that ultimately we're helping the immune system over time get smarter and better at recognizing that the Lyme and whatnot is there, and that is ultimately what leads to longer term healing. It's not obviously like a garden variety strep throat where you have a sore throat and you have a positive strep test and you're going to take 7 days of antibiotics, everything's going to be fine, because those bacteria are not in a privileged site and they're reproducing all the time, and so antibiotics can get them. It's easy. But once they're kind of in those more privileged sites and they're kind of dormant and those persister forms, you need to approach it differently, because all the antibiotics in the world can't help you if your immune system can't use them properly.
Yeah, exactly. And I think one of the I think it's just so complicated. And
it is.
I think, right, we talk about it being complicated, but then when we start our treatment protocols, we want it to be easy and simple. And I think the easy, simple part of this whole thing is when you work with someone who understands the variety of possibilities out there, the protocols that are out there, who's dove in, and then they sit down with you and they take your individual story, your individual symptoms, your individual physical exam, conversation, get to know you as a person, your individual lab results, and then come up with what I would call a plan. And, so one of the things that I think is so important is there are so many options out there. Stop comparing yourself with anybody else, because what works for them may or may not work for you, and what order it worked for them in may or may not be the right order for you, even if the same treatments are the same are important for you. The other thing is, if you have Lyme and Babesia and Bartonella and mold, and your friend has the same ones, you will probably still have a vastly different healing journey. So I just think it's so important, right? Just a quick question, because I like to grab the questions and make sure people know what we're talking about. Questions about what is a fasciculation, and fasciculations is like these random, spontaneous, like muscle contractions kind of under the skin that you see them moving. So you might see somebody's jaw twitch. I think actually, as I'm mumbling on here, I'm thinking one of the greatest fasciculation examples is if you've ever had your eyelid twitch. A lot of people, that's not necessarily a Lyme or Bartonella thing, could be, but mostly it's just your eye is twitching. But if you have like that little like eyelid twitch on the back of your neck, and then on your left bicep, and then in your right calf, or and these fasciculations, you can have certain fasciculations in certain muscle groups, and if they're consistent, I love your water bottle, by the way. I know that's from LDPC. Yeah, it's funny. It's like I try to, that was one of the gifts we gave everybody who was part of our program, because, I want everybody to stay hydrated, and I want to remind them that of all the fun work we've done together. But, the thing is with the fasciculation, if it's in a particular spot and it doesn't move and it's more consistent, that is definitely a reason to talk to your primary and or a neurologist really quickly. But if it's a little here, a little there, a little there, a little there, and there's no consistency, you should still talk to your doctor about it, but maybe it's not a neurology referral, or maybe it is. But the bottom line is I think a little more Lyme-Bartonella mold in that situation, whereas I think of other neurodegenerative disorders if I'm looking at a single thing. So again, definitely that's not one I would screw around with, right? If you're fatigued and like kind of have a little muscle aches and you're like whatever, and you're not really having swelling and you're not sure and you want to play around for a little bit maybe with your own online research or whatever, I mean, I still always like going to the doctor, but it's probably not as severe just on the surface as if you're having like, a fasciculation of only your right calf. That's definitely something that you should have someone taking a peek at sooner than later. So, and as I mentioned at the top, Jess, I wanted to kind of talk some of the overview of things we look at. And one of the things, though, I think with healing, and this is, and just as a reminder to everyone, that we're really excited to be kind of able to offer more support in our office than we've ever been offered before. Multiple doctors, health coaches, neurofeedback. We've got all kinds of really great stuff to support you. And then for practitioners out there, we've got the Lyme Disease Practitioner Certification Program. And any coaches and other folks, we actually have a program coming out in probably by May, which is specifically for those who want to learn all this background stuff, but don't need like the full bore, like, year-long mentorship that an MD-DO, APRN, physician assistant might need. That's available to you too, but at the same time, you might not need that level. So we have a lot of those support things. But in our support group here, I really wanted to open the conversation to the different healing possibilities and use tonight's conversation as a starting point, not like, yes, this is sort of like a training discussion session, but more like we want to touch on a few things that we're going to dive deeper in over the next weeks, months, and years. So one of the things I think is so important, and I just love about you, Jess, and the conversations we've had is your understanding of medical cannabis, because there's a huge role potentially for certain people with persistent Lyme disease and similar infections. But I feel like my experience in a lot of states that either where I could write a card for or I know other people have gone is you go to the doctor, they go, oh, you meet the criteria, it could benefit you, just go to the pharmacy and pick some stuff up and try stuff out.
I know. I mean, it would be kind of like if, you took somebody who'd not learned anything about pharmaceuticals. And, you just sent them to the drugstore and the pharmacist just said, well, why don't you kind of come back here and just take a look at all these different bottles and, maybe something here will help you. Just try it. We would never do that, obviously, and we have a lot of laws in place where that could never happen. But, we're in this interesting time with cannabis where you have what I always like to joke around that it's an ancient emerging therapy. Right? Cannabis has been used by human civilization. Our first uses are over 5,000 years ago in China. It's not like this is a new compound. It's not even a compound. It's a very intelligent plant. And because we kind of got cut off, unfortunately, in the early 1970s, the research that was really being done in cannabis and then kind of some other related modalities, when the war on drugs was proclaimed, all of that research stopped. And so we've had to kind of find our way back to seeing the value of cannabis, not as just some fun thing to relax, like the way someone might perhaps think about alcohol, where they say, oh, I'm just going to, have a drink and have a little fun and relax. There is that aspect of cannabis. However, the more important aspect is that this is actually a plant that has the potential to offer different kinds of healing. Sometimes it's symptoms, and for a lot of people it is symptoms. That's one of the main things I use it for. I have a lot of success with it, but there's also, this plant has its own effects on the immune system, has its own effects on certain microbes, so bacteria and whatnot. Like we're in our infancy, with this part of cannabis, but it's fascinating. Many people may have heard of a bacteria called MRSA, which stands for methicillin-resistant Staph aureus. But we talk about MRSA a lot, causes skin infections and whatnot in different circumstances. Cannabis, especially cannabis that's high in a particular compound called CBG, and I'll talk about it in a minute, can actually be as effective as regular antibiotics for MRSA. And that's huge because we face all of these problems with antibiotic resistance for certain organisms and bacteria especially. And that's scary when things are resistant to antibiotics. And so people are now starting to look at cannabis as a way that we might be able to actually break through some of that. And so when I said I would, talk about CBG, I'm not going to get crazy into it now because obviously I could go on and talk about this for hours and hours. But it's just to say that there are over 500 active constituents in the cannabis plant. It's not just THC or CBD, although those are certainly the two best studied and the two most active. But there are tons of other, what they call minor cannabinoids, and things like CBG, CBDA, etc. And these all have impacts. There's also a compound class called terpenes. Terpenes are, you can think about it as the compounds that give plants their smell, their flavor. These are terpenes. And terpenes and all those minor cannabinoids will impact your symptoms, can impact maybe even certain illness processes. And so the whole issue, of course, with sending somebody to the dispensary and saying, just go and ask for something and take your chances, is that, well, depending on what's going on with you, you may do better with certain strains, for example, certain varietals of cannabis, and then say another one, and you're not going to know that unless you're talking to somebody who can say, okay, no, go to the dispensary, get this exact product, this exact dosing to try. I mean, like anything, there should be guidance, and unfortunately not enough of us are trained. It's one of the reasons I got trained, because I felt like I wanted to be part of the change, where we really bring cannabis in for its medicinal quality, not just as a way for people to bliss out and not care about anything.
Yeah, it's really interesting because some of the times where we've worked together with people and you've shadowed on a call or whatever, I'm like, I don't know. So I phone a friend. I phone Dr. Jess, and she helps out. And it's literally so many specific changes can be made if you know what you're looking at and you're really getting clear that we're using it as a medicine. And the intention there. And one of the other medicines that I love to use a lot of, and I know a heck of a lot more, about, is ketamine. And, ketamine can be used in a lot of different ways. We use a lot of intranasal and oral, but again, it's got to be in an appropriate setting. But what's really cool about a lot of these and this is probably not classified as an ancient emerging medicinal. It's not really a plant. It's more of a drug. But what we found is ketamine has antifungal properties. Ketamine has anti-borrelial properties, so anti-Lyme properties. We found that it has some of the strep and staph things in bugs that you can get on your skin. It's been shown to kill. Now, the other thing that's really interesting is we use it a lot for depression and chronic pain, and you can actually do scans of people's brains in real time and give them a dose of this stuff, put them in a scanner when they have depression, and you can see the nerve synapses or the connections essentially in real time start to almost immediately rewire to a more normal pattern. So in depression, we see they talk about proliferation of synapses, but properly. But also if you look in places like the limbic retraining we talk about, a lot of people get really kind of wound up. Their limbic system gets all jacked. They're in survival mode all the time. They might go from fight or flight to freeze. And they're just unable to get out of this spiral of illness. And they know there's a huge mental component, but it's not like they made it up. I mean, even some of the research shows Lyme can actually do this to you. I mean, directly, and then also being sick for a long time will just cause it as well. But the interesting part of it that I find is that we can use these drugs. There's a thing called the synaptic pruning, where so if we have too many connections that are aberrant, this will help remove those, and it'll help regrow the connections that allow us to be happy and blissful once we don't need these things anymore. And so it's just really interesting that and I guess the one thing I have in the back of my head that I was going to say, I know some people also with use MDMA for different things, and we're not going to dive into that right now. But to say a lot of the illicit substances that people have used over time, or things that have become illicit or have a taboo, they're used, if they're used appropriately. And for me, whether it's cannabis, whether it's MDMA, whether it's psilocybin, whether it's ketamine, or whether it's your antibiotic, it's azithromycin and rifampin, whether it's binders, whether it's herbs, a lot of what has to happen here, or a lot of what impacts it, is sort of the intention around it. So I was wondering, like, Jess, if from my perspective, like, it's easy to know, like, I know a whole bunch of people in college who played around with LSD, and if they thought they were going to have a bad experience, they usually did. If they just jumped in and they didn't know what they were doing, they would often have a bad experience. But if they knew that their mind could control something, they could say, hey, I'm going to have a great experience. And if something kind of goes awry, I'm just going to allow myself to come back to the happy side of it. And they almost always had a great experience. So when I see people taking treatments, so even if we leave these emerging ancient medicinals and we leave the sort of the more psychedelic-y things, because we'll dive deep into that at some point, what do you see with people in terms of, like, I'm about to have a sip of my sparkling water here, like, but let's pretend this is my, Pectosol C in my water, and what rituals are important for healing, or is there even an importance around it, or the mindset going into a treatment, whether it's cannabis, whether it's MDMA, whether it's an herb?
No, I think mindset is huge. And when we talked about, when I said earlier that, people can sometimes have an emergence of infection symptoms when there's been just all of this stress in their life. Well, we're a pretty stressed out world, a pretty stressed out culture. And I think that we can be more likely to both get sick and then be less likely to heal from that sickness if our minds are not in the right place of focus. And I think that the idea of when you've got, that Pectosol C in the water and you're drinking that, as to help with with binders, like with other, types of, symptoms, it's a really great compound. If, I guess the feeling in the moment is, oh, this stinks. I have to keep taking this Pectosol C and I'm not it's not working fast enough, and why am I doing all of this? I do think that there is, unfortunately, in those situations, it can be harder to get people better because there's a lot of course, focus on what they don't want, which is their pain, their fatigue, whatever else they may be, going through. And it's not to minimize those symptoms. I think that part of doing this work, of working with people who perhaps had some kind of a chronic complex illness, is holding space as a practitioner, being present to witness and both, say, okay, I want to validate, your experience and your disappointments and your suffering. And at the same time, I don't want you to focus on all that. I want to move forward. I want you to move forward. And so maybe, the Pectosol C, should be taken more with the attitude of, over time, this is going to be part of getting me better. Maybe, it's, just taking a little bit of a moment to have a couple of deep breaths and calm the mind, if it's been a hard day, as it often can be, and just say, I'm going to this is something I'm doing for me. This is really all about me trying to take care of myself. It's not something where I have to put all of this weight of expectation or emotion on it in the moment and be maybe angry that things are perhaps not happening as quickly as I want, but to say that this is part of my plan, and it's part of me taking care of myself.
Yeah, I think it's so critical to like make it that symbol. You know, there's so many of the things we do, like in neuro-linguistic programming, they talk about anchors, you know. And so if you want to, you get yourself into a certain state, like a heightened awareness state, or if you're someone who's going to do public speaking, right? And so many people, that's like the next thing next to death that people fear in the world. I, on the other hand, kind of like it. So, but I just decided that public speaking was good. So when I get nervous before I public speak, I go, that's my immune system, that's my nervous system getting jacked up and excited to do a great job. Whereas other people I know, right?
Yep, fear and excitement are the same thing. It's just a question of perspective.
Yeah.
It's a question of perspective.
1000%. And, I don't know what it is. My thing just changed. I only see myself on the thing, not you. So hopefully we'll get us back to add to the lab.
I see me.
It's so funny. Now I see you, but I don't see me on there. It just there we go. It just, I love these things. I didn't even touch anything. I was just trying to reply to one of our guests in the chat, and I guess I must have tapped something. The trackpad today, I don't know. I think I'm resting my pinky on it instead of on the desk. But anyway, yeah, it's like that. You can choose, right? It's like, so hey, my pupils are kind of dilated. So the sun's a lot brighter. My heart's going like this. My breathing's a little bit like this. I kind of feel a little jittery, and so what is that? You know, a lot of people describe that as anxiety. I would also say that exact same thing is excitement, because I just described when I looked into one of these ski runs that was super steep and super powdery that I really wanted to do. And so was I a little scared? Yeah, but was I prepared physically to do it? Yeah, so I did it. But that exact same physiologic experience that I just labeled excitement, someone else could label like, I'm not ready to do that. So I'm afraid for my life. And that's really like, I think a key is like, stop labeling shit, right? I mean, this is like, if I could teach people any one thing, if I could teach myself any one thing, stop labeling things. Tell us what it feels like, right? Don't say my Lyme, my Bartonella, my mold or whatever. I'm a limey, I'm a moldy, because they're just going to mean you limit the possibility of healing, and it's a self-fulfilling prophecy, right? If you label yourself a limey, like everybody I know who's a ski bum and labels themselves a ski bum, what do they do a lot of? Ski, right? And everything in their life opens up around getting to do more skiing. I know people love to play tennis, and what do? They play a ton of tennis. But if you're like, hey, you know what? I really enjoy playing tennis, but my life is really busy. I don't have a lot of time to do the things I like. Guess what happens in your life? That. And so I think it's really important. Like I would love every single time you put a supplement in your mouth, thank yourself for taking care of yourself to such a high level. This is a sacred ritual. You know, it's just like eating. You shouldn't just shove food in your mouth. I mean, I'm sitting here, I'm thanking broccoli for letting me eat it. And I'm very thankful to, now that I know that my personal body does much better when it has red meat. I was a vegetarian for 13 years. Didn't help me much. And I was a good vegetarian, right? I was eating vegetables and stuff, not just like pasta and chips. But my particular physiology needs certain things. And when I give that to my body, I'm thankful to myself for doing it. And I'm also thankful to the substance that I'm ingesting for nourishing me. Because otherwise, you're just not paying attention to it. So then, and when you're not paying attention to these things, you're off like going, oh, I'm worried about this and that. Why don't we get into the present moment? Not by doing some, I love Eckhart Tolle and everything, and I'm all about that stuff and all these other leaders in mindset and all this other stuff. But the bottom line is, it doesn't have to be, we're having this conversation, Jess, with our daughter, Talia is the most amazing person I've ever met. And she's growing up in 2023 as a 13-year-old, right? All kinds of cool challenges, lots of exciting things that you can do. But we've talked a lot about meditation because That's a buzzword. It's a thing I like to do, but I used to not like to do it. But one of the biggest problem we have with meditation is she doesn't like the word. Mm-hmm. So good, use whatever word you want. But the idea is that your meditation could literally be, I'm putting food in my mouth and I am recognizing that I am taking care of myself and I'm nourishing myself. Because my favorite definition of meditation is to become familiar with. And so the idea is to become familiar with the state you want to live in. So are you living in a negative meditation with Lyme disease, bitching and moaning about Lyme all day long? Or are you acknowledging how you actually feel? And then are you taking action? So to me, everybody's like, oh my God, you can't just think your way out of it. No, you can't. But what you can do is acknowledge that you're not feeling well, but also acknowledge the things that you are doing to feel better. Because so many of us will give other people credit for doing stuff and I can't do it, or I'm not good enough. You are all worthy of healing. You all deserve to live an amazing life and to shine your brilliant light on this planet and beyond. But you can't do that unless you first acknowledge that you're actually doing what you need to do to heal. And it's amazing when you just stop bitching about the amount of supplements you have to take and you go, this is a signal to the universe, to God, to divinity, to yourself, most importantly to yourself and your heart, that you're taking care of yourself. Give yourself credit for all the work you're doing. I mean, Jess and I are doing a good job and all, helping you out, but heck, we're with you for 30 minutes every month or two, and we tell you what to do, and we might send you a little message. But the bottom line is you're with you every day. Love on the fact that you actually love yourself and you're taking care of yourself. Give yourself credit. So, and, we could go on this, for this topic forever. And it's funny, I was talking to Dr. Engels, who's a really great friend of mine, and he's doing the Lyme Summit with us. And we were talking, and we brought up the gap and the gain, which is a concept that Dan Sullivan and Ben Hardy talk about for entrepreneurs. But it's this concept, and it's funny. I'm looking over here because I have it here, and at the if there wasn't a bunch of light things in the way, I could show it. But it's basically the bottom is where we start, and then we move up, and it's like, so you start here, you're here now, and you want to be there. So what the human brain does so often is it's so easy to focus on the gap between where you are and where you want to be. But very commonly what we forget to do is say, I started here and I'm here now and I've gained all of this. So if we are able to focus on, it's not the gap doesn't still exist. It's not that you don't still want to get better or even need to get more betterer. I love grammar. But the thing is, Jess, it's like if we focus and we give ourselves credit for the gains we've made, and we acknowledge that we still have a gap that we would like to, these are the gains I would like to get. Totally, it's exact same thing. It's semantics, but it means something so much to your heart and to your nervous system. So when we talk about limbic retraining and all these other things, it doesn't make a damn bit of difference what program you do. I'm sorry to break the news to everybody. You need to do the program that works for you, and you need to change your own mind. Right? So you could ask me for recommendations. You could take my program, you could do Gupta, you can do Annie Hopper, you can do neurofeedback, you can do all these things. Don't compare yourself to other people. Literally start by saying, I'm going to bed a half an hour early, and I'm grateful to myself for caring that much about myself. I'm going to take these supplements that the intention is to heal myself. Just do it. But acknowledge that you're doing this for yourself. It's so critical. So anyway, I mean, we will definitely be doing lots of conversations about this.
Yes.
But so Jess, as we kind of roll through our hour here, any things that like you want to kind of share with people? I have a really exciting announcement about a summit that's popping up actually it starts next week, I think. So I will share about that in a moment. But any things as we land ourselves this evening, and we've talked about a lot of things. One other thing. I'm sorry. Let's see. That's cool. Somebody's son is in the meditation and it's magic. That's awesome. One thing that someone asked earlier was, and I wanted to just touch on it briefly here, and this is a completely other subject. matter. But where did it go? I think I just lost my thing. But it was about the signs and symptoms of PANS and PANDAS in kids. So I figure I'll just give you a quick little thing on this, and then I'll let you answer the question that I asked before I forgot that I didn't, or remembered that I almost forgot this. Did you see what I just did? I just want to point this out for everyone. I said I forgot, but I didn't because I remembered. So then I rewound it and I said I almost forgot, and then I remembered.
Yep.
So literally,
you made it a much more positive sentiment. I mean, truly. I mean, and that may seem not important in the moment. This wasn't some earth-shattering moment in your life, but the accumulation of all those moments over time does a lot, for how your brain sees things.
Totally. So quickie on PANS, and then I'll let you close this out, Jess, and I'll give the quick announcement on the free summit that's coming up. So, I always like to get people, and this is actually, I talk about PANS in the summit too, and because it's going to be let me do this the other way around, because I don't know how to not talk about, we're talking about PANS and PANDAS, and we're talking about the summit that's coming up is microbes and mental health. And so I will drop a link in the chat about that. But Microbes and Mental Health is March 14th through 21st. It's online, and it is absolutely 100% free, Microbes and Mental Health. And one of the things we will summit, what did I just say, March 14 through 20, I think? Let me double check. 21. Youth 2023. Here you go. Got it for everybody. One of the things I think that's so important just to understand about PANS and PANDAS is, like the late, great Dr. Charles Ray Jones shared with everyone, it's an infection-triggered autoimmune brain inflammation. So a lot of times what we see, some of the core pieces of PANS are an abrupt, dramatic change in behavior, including like severe food restriction, starting to pee your pants again, obsessive compulsive disorder. We can also see neuropsychiatric symptoms such as, and the diagnostic criterion, aside from an abrupt OCD or food restriction, you need two of these other ones, which is emotional lability or depression, anxiety, irritability, aggression, oppositional defiant stuff. Behavioral regression. So like you're at school, your handwriting goes to pot, like your drawings go from beautiful to can't even see what it is. Behavioral regression, acute ADHD is not a thing, but it is if you have PANS. A lot of sensory stuff where kids don't want to wear certain clothes, or things are too tight or too loose. Food aversions, motor abnormalities. We see a lot of tics. So you'll see kids like doing this kind of thing, or, like weird licking, or all kinds of different things. And then we have to look that these symptoms are not better explained by other things, right? Because it could be other things can do this. So we see a lot of those things. And we'll dive really deeply into PANS and PANDAS in the future, but that's just that's like 100 million mile an hour primer. But basically, if you had a kind of normal kid, and then that all changed abruptly overnight or in a very short period of time, and all of a sudden your lovely child needs an exorcism, or is scared of their own shadow, or won't go upstairs without you, you got to start thinking about Bartonella, Lyme, strep, mycoplasma pneumonia even induced, and autoimmune encephalitis, which we call PANS and PANS. So if you want to learn more about that, check out the Microbes and Mental Health Summit. Like I said, it is free. Every day you get the full, every day there's a 24-hour period of time where you get that day's videos at no charge, and just a wealth of information. Had a blast doing that. So I know I tangented a little bit, but since there was the PANS question and I wanted to do that. But so just, as we wrap everything we talked about today together, I know people have asked for more PANS, more conversations about how to structure treatments, and they said it might be hard. Definitely we can do that. There is a concept of how to structure a treatment plan understanding that all those protocols we talked about may or may not be the right fit for you in the moment, but there's definitely a strategic way to do that, and we will definitely keep that on our list. So I'll let you have the last word, since otherwise I won't stop talking.
I know. It's just one of the
I get
things
too excited.
That we all love. I know one of the things we all love about you, and you know why you're so much fun to listen to in your summits and your Facebook lives. But no, I think that it's just really great that this group is being revitalized. And the fact that we're going to have a chance to spend a lot more time here. I'm really looking forward to co-moderating and getting to see just what questions people have, what they want to discuss. I think that I'm definitely somebody who, the more I can talk and teach and discuss things with other folks or for other folks, the more I'm going to learn, and then the better I am able to help other people. So it's like we're also getting something out of this, even if we're kind of the presenters. I think that we're getting a lot of benefit from it too. And so thank you, really, to all of you for being here.
Yeah, I love it. And thank you for being a part of our team and a part of our Lyme Disease Practitioner, training program and certification, and for being here. I mean, one of my biggest frustrations in medicine is when we throw out treatments and we don't provide the appropriate guidance. So your understanding of functional medicine, your understanding of cannabis are things that our patients are using in their lives each and every day. They're being prescribed appropriately by their physician, and they might not be getting the support they need. And as a reminder, none of the stuff we're talking about is meant for, it's all about education, right? It's not meant to help diagnose your specific thing or tell you exactly what strain of cannabis to use for such a thing, but we're in your particular individual situation. But we're going to talk a lot about specifics in all these different nooks and crannies that then you can use that knowledge to help guide you and bring in front of your practitioner to help you move forward. I just think it's so cool that we know so much and that we have the opportunity to share that with you. So Jess, I know we're going to have many, many other conversations like this. Super pumped about having you here, and thanks for making the time to join us for this chat. Everyone, thank you all for joining us, and if you're watching the replay of this, just feel free to drop questions and comments in the comment section. We'll make sure we get back to you on that. And then any ideas for future things? I know people have asked about PANS and PANDAS. People have asked about how do we put treatment plans together in a way that doesn't have you just grabbing at everything. What is that roadmap? I mean, one of the things we talk about in the LDPC, which is our Lyme Disease Practitioner, can't talk tonight. Must be time to wrap things up, right? If I'm tripping over my own tongue. But Lyme Disease Practitioner Certification and Mentorship Program is a roadmap of how to go through and systematically determine what the best next steps are and what all the steps on the table should be. So we'll break that down, and we'll talk a lot about that as well. So thank you all from the bottom of my heart for joining us. Any questions, comments, leave them in the comment section, and we'll be happy to get back to you.
Take care, everybody. Have a good night.
Have a great evening, everyone.